underfunded,
don't need these cuts.
understaffed,
We need more doctors.
and riddled with gaps.
Our people with mental illnesses are in worse shape today than they were when I started 30 years ago.
Iowa's mental health system is falling, almost hitting the bottom. Shrinking budgets have placed the state near last in available doctors and open beds.
Nobody wanted to make cuts from any point in the Johnson County MHDS budget, but we had to.
As individual counties in the state fund a large portion of their mental health services, here in Johnson County, they recently called an emergency meeting as they prepare for a $2.5 million shortfall just this year.
It's either going to be administrative cuts to MHDS or services.
For 31 years of consistent services has taken him out of jail and out of underfunded.
Carol Spaziani talks about her son, a 49-year-old diagnosed schizophrenic who's relied on these services since the age of 18. But Spaziani says it wasn't always this easy. The hardest time was simply getting her son in the system.
When they're newly diagnosed and trying to get into the service system, after they get in, things kind of settle down.
Over the past year, budget cuts forced 7 counties statewide to adopt waiting lists for their mental health services, which could potentially make it even harder to get in the system. And this is something directors in Johnson County fear may be their next step, along with cuts to optional programs, like the home care service Spaziani has relied on for 31 years.
It's optional services that the task force has to review.
While Spaziani is concerned about her son's future in the system, as an advocate for the mentally ill, she's worried too about the Iowans' struggle to enter the system, a struggle she thinks will only get worse as cuts continue. For Iowa Watch, I'm Shannon McDonald.